Africa is working round the clock to end the spread of HIV/AIDS by 2030. Worldwide, there are around 36.7 million people living with HIV/AIDS, mostly in sub-Saharan Africa. Every 2 minutes, a teenager between the ages of 15 and 19 is infected by HIV, nearly 2/3 of them girls. UNICEF has warned that new infections among young people may rise by 60% if urgent action isn't taken.
It's a prediction, it could even be worse. It's 400,000 in 2030 if the current infection rate stays the same. If funding for prevention programs and so on dries up, if school programs don't roll out, if economic inequality is exacerbated, it could even be worse than that.
However, there is a solution.
There really hasn't been enough attention to prevention of new HIV infection, especially amongst adolescents. And I'm not surprised, but I am disappointed. Unless we focus on the reality that many young people are sexually active, we have to talk about that reality and address it.
AIDS remains a leading cause of death among young people worldwide, claiming 41,000 lives in 2015. Livy van Wyk was 17 years old, pregnant when she learned she was HIV positive. Thanks to antiretrovirals, her son is HIV-free. Now she shares her experience with other young people.
Unfortunately, in my case, it is my story. But I hope I can end this story so that, for example, my son's generation, his peers, don't go through what I faced. So that is why I am so strongly into this, to try and decrease the further spread of HIV, and it's especially amongst the new generation.
UNICEF says too many children at risk aren't receiving treatment.
The worst time of a child's life with HIV is 0 to 4 years, because up to 30% of them will die by year 1, 50% will die by year 2, and 80% will die by year 5. So we have to really redouble our efforts to find the children, but also link them into treatment and maintain them into treatment.
The fight is far from over, and despite progress in averting new infections, around 400 children become infected every day. So if efforts are not doubled and funding stalls, AIDS will continue to be a leading cause of death in adolescents globally. Julie Scheier, CCTV, Johannesburg, South Africa.
Jackie Murema is a hip-hop artist from Limpopo, a province in the north of South Africa that has a high rate of HIV infections. Seeing the devastation firsthand, he decided to use his talent to educate people about the disease.
It's one of those days that as a person that lives in the community, you've seen how HIV has destroyed communities, how it has destroyed families. Me as an artist, I feel it's still my responsibility to make sure that we conscientize the community and through music and through our art.
More artists around the world are getting involved.
Artists have been making sure that they release music with the message, and not only the music, but then as artists we should go beyond the music and say, with our lives, with our impact, with the influence that we have, can't we go out there and make sure that we use that to positively?
But there's still a long road ahead. Since the South African government implemented a strategic plan on HIV and AIDS, sexual transmitted infections and tuberculosis, there's been good progress in making treatment available and affordable. However, stigma and discrimination persist.
We have a legal framework that protects, that's aimed to protect people's rights. So, for instance, if you want to access treatment, you need to be in a health facility that's more conducive to what your needs are. And you will find that there's still discrimination of people living with HIV in the healthcare settings, in the employment settings as well.
South Africa's weak economy has cut funding to organizations such as Love Life. It was at the forefront of the government's education and awareness campaigns.
We have had to reduce our operations to about half in the year of 2016, following a dramatic reduction of our Department of Social Development funding. which means that we weren't able to reach as many young people as we have been able to reach in the past. We haven't been in as many communities as we have been in the past. And you would appreciate, as the rest of South Africa would, that the issue of HIV infection among young people is still a rife one, and that we need to put in more effort.
The government is spending $3.5 million a year to treat people living with HIV and AIDS. AIDS drugs are now free and available in all public health facilities. Research funding has also increased significantly.
We're constantly researching and investigating vaccines. The best vaccine will be a vaccine that gives you 100% protection. But if you can't get 100% protection and you get a vaccine that gives a person 60 or 70% protection, then we may go with that in the short term. We would rather keep to the main messages of HIV, that the best vaccine to protect yourself is yourself.
South Africa has made great strides since the 90s, but there's still some way to go, and everyone has a part to play. Sumitra Nadu, CCTV, Johannesburg, South Africa.